Hello everyone, my name is Anjali Shankar, and today I'm going to talk about ASL Health Literacy and how it affects healthcare for the deaf community. The lack of communication, or proper communication, between deaf patients and healthcare workers lead to many health disparities among the deaf community. First, deaf individuals are more likely to be misdiagnosed or undiagnosed, and this is likely due to the fact that there's a miscommunication with possible symptoms, or maybe healthcare workers are less likely to catch something if they can't properly understand what the patient is trying to convey. This also leads to less likelihood to secure appointments in the primary care office. There was this one study that stated that 80% of hearing individuals were able to receive a follow-up appointment, while 50% of deaf individuals were able to. And many cited the lack of interpretation as one of the reasons why. And because they have less preventative care, primary care meetings, deaf individuals are more likely to take trips to the emergency room. And this often indicates more severe medical conditions and higher medical bills as well. Due to these issues, there is a prevalence of anxiety and depression among deaf adults. This could also be due to the discrimination that the deaf community faces as part of the disabled community, as well as higher rates of suicide. Again, due to the chronic stress of discrimination and the lack of proper communication in healthcare. There's also a prevalence of chronic diseases such as hypertension and diabetes, and due to the aforementioned points, they can escalate further and cause preventable issues if they're not treated properly. And lastly, they also have a higher prevalence of cardiovascular health risk. So, I wanted to address this intervention because, as per the Americans with Disabilities Act, under the Effective Communication section, deaf parents and family members, as well as patients, they have a right to interpretation. However, there is a shortage of ASL interpreters. For example, in Connecticut, around 5% of adults have a hearing disability, which roughly equates to around 125,000 people, but there are less than 500 interpreters in that state. And of those 500, even less of them are actually medically qualified and have the proper certifications to serve in a medical office. And so it can be really difficult for these people to get that interpreter that they're entitled to. So the purpose of my intervention is to educate healthcare workers on basic ASL communication in a medical context, empower deaf individuals and improve their access to an interpreter if requested, and improve communication between healthcare workers and deaf patients. So what I'm going to do in this video is go over 20 basic ASL vocabulary terms that are often used in a medical context, as well as the signs for the alphabet. And hopefully that will, with a little bit of education, healthcare workers can watch this video and have a basic understanding and basic communication if they were to encounter a deaf patient. While this does not completely solve the problem of a shortage of interpreters, my goal is for more of those initial interactions to go more smoothly and basically educate healthcare workers on how to treat and deal with and work with patients of the deaf community. So thank you all for watching. Stay tuned for the alphabet and 20 vocab words that you as a healthcare worker should know in ASL. Now we will go over the ASL alphabet. But first, just a quick reminder. ASL is a language. It has its own grammar and its own syntax. And so although we will cover the alphabet, it is much more effective to gesture and visually explain medical conditions or situations rather than spelling every single word. Fingerspelling is usually used for proper nouns like names or abbreviations or acronyms like CPR. And so when in doubt, explaining something, it is much more effective to gesture or use like diagrams and drawings. However, fingerspelling can be sort of that last resort option. So now we will go over the ASL alphabet. Feel free to pause the video and practice as many times as you like. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, Z. A good way to start when meeting a deaf family member or a deaf patient is to ask how they are. How are you? Now for some basic medical procedures. Blood pressure. Injection. Surgery. Bandage. Test. Medicine. So the sign for prescription is RX, so RX. However, if the patient doesn't know what that means, we can say write and then give. Emergency. Bleeding. Infection. Aspirin. It's very similar to medication, except you point at the head afterwards. Hurt. So if a patient is injured, or you're asking them where something hurts, you can point it anywhere in the body. So, does your ear hurt? Does your stomach hurt? Does your mouth hurt? Does your head hurt? This means help. Make an S. Cough. Nausea. Fever. Heartbeat. Dizzy. And those are 20 ASL vocab terms and the alphabet for you to get started. As a reminder, if you work in the healthcare setting, it is always encouraged to learn more ASL and about the deaf community and deaf culture. I hope that you all are encouraged to learn some more ASL. There are many ways to sign things, many ways to communicate nonverbally, and I really hope that we all take the initiative to learn and hopefully are inspired to get more interpreters for those who really need it. Thank you.